Okay, so hip bone is made up of 3 bones which fuse during early adulthood. আর প্যাটেলা তো হয়ে গেছে, প্যাটেলা তো আমি পড়িয়েছিলাম। হ্যাঁ হ্যাঁ, ঠিক আছে, তাহলে হিপ বোন ডিসকাস করলেই কমপ্লিট হয়ে যাবে। ওকে Okay, so hip bone is made up of 3 bones which fuse during early adulthood at 18 years of age. Okay, and the ilium forms the superior portion of the hip bone. See, this violet colored portion is the ilium. It forms the superior portion of the hip bone. Ischium forms the lower posterior portion. This part is forming the ischium. Okay, and ischium forms the lower posterior portion, and the pubic or eta bondo korbe to pubic bone or pubis, it forms the lower anterior portion, the red colored portion forming the pubis. So these are the 3 components of the hip bone, or hip bone is also known as innominate bone. Okay, ilium, ischium and the pubis. Now we are going to the articulation of the hip bone. Three articulation sites are found in each of the hip bones. The 2 hip bone meet anteriorly at the pubic symphysis. Here is the pubic symphysis, and converge posteriorly with the sacrum. Here it is articulating with the sacrum at the sacroiliac joints, and laterally deep sockets are present called the acetabulum. Okay, 2 acetabula are together forming acetabula and accept the heads of the femur to form the hip joints. Okay, hip joints you have read. So you have to know the type of joints. Okay, this is cartilaginous joint, this is synovial joint, and here is the another synovial joint, hip joint, ball and socket type of synovial joint. So the right and left hip bone form the pelvic girdle, and together the pelvic girdle, sacrum and coccyx forms the final 3 to 5 vertebra, make up the ring of bone called the pelvis or bony pelvis. Here this is the bony pelvis. Okay, you can see 2 hip bones articulating with each other at symphysis pubis, posteriorly articulating with the sacrum, and here at the lower end of sacrum coccyx is articulating. Okay, and here at the acetabular cavity articulating the head of the femur. So they are forming a ring of bone, the sacrum and the 2 hip bones together. This is bony pelvis. Okay, and this bony, what is the function of this bony pelvis? It protects the soft organs of the pelvic cavity, bladder, lower colon, that means the large intestines, mainly large intestines, rectum and the reproductive organs. They are protected by this bony pelvis, and it also provides attachment point for many muscles that control the movement of the back, abdomen and the femur. Okay, so see here, this is ilium, ischium, pubis, acetabular cavity, this is obturator foramen, and this is the pelvic inlet. Pelvic inlet divides the pelvic cavity into 2 parts. Upper part is false pelvis and inner lower part is the true pelvis. And these are the body of first sacral vertebra, ala of the sacrum, sacroiliac joints. Here is the iliac fossa, anterior superior iliac spine, anterior inferior iliac spine, iliac crest. This is the acetabulum. Here is the 2 ramus, superior and inferior ramus of the pubis, and this is also known as ischiopubic ramus. And in this part, ischial tuberosity. Here is the pubic crest, pubic tubercle, and this is symphysis pubis. Okay, and you can see at the tip of the sacrum, coccyx is articulating. So these are the basic bony presenting features of the pelvis. So this yellow colored portion is the ilium, violet portion is the ischium, red colored portion is the pubis, and these are the different presenting parts we will discuss. So first is ilium. Ilium has a iliac crest. Okay, iliac crest or crest of the ilium is the carved upper ridge of the ilium, and these are the muscle attachment of the iliac crest. See, this is a superior view of the iliac crest. We divide the iliac crest into two parts, anterior 2/3 and posterior 1/3, or dorsal part, ventral part and dorsal part. Ventral part have a outer lip, middle area and the inner lip. Okay, outer lip gives attachment to the insertion of external oblique and posteriorly latissimus dorsi. Middle part, internal oblique and inner lip gives attachment to the transversus abdominis and the quadratus lumborum. Okay, and in between these two, here is the petit triangle or lumbar triangle in between latissimus dorsi and external oblique, and here is the attachment of the at the outer lip, attachment of tensor fossa lata. Okay, so these are the muscle attached in the anterior 2/3, and at the anterior superior iliac spine, sartorius muscle is attached. Okay, and in the dorsal 1/3, dorsal part is divided into medial and lateral halves. Medial half gives attachment to the erectus spinae, and lateral half gives attachment to the gluteus maximus, which is continuing posteriorly along the gluteal surface. Okay, posterior to the posterior gluteal line. So this is attachment of the iliac crest. This is very frequently asked in your viva table. Tell me the attachment of the iliac crest. You describe as anterior 2/3, posterior 1/3. Then anterior 2/3, outer lip, middle area, inner lip, and their muscle attachments, and dorsal area divided into two parts, outer part and inner part, or medial or lateral part. Okay, and you remember the muscle attachments. Next we are going to the iliac fossa. This part is the iliac fossa. It is a broad depression located along the anteromedial surface and inferior to the iliac crest. Here is the iliac crest, inferior to the iliac crest. It is an attachment point for the iliacus muscle. Okay, iliac fossa, attachment to the iliacus muscle. And there is anterior superior iliac spine. Here is the anterior superior iliac spine. It is a anterior projection from the iliac crest. আর তোদের বাকিরা কোথায় রে? এত কম জন কেন? অ্যাটেন্ডেন্স এত কম কেন? এটা কিন্তু কঠিন বোন, নিজে নিজে পড়ে বুঝতে পারবি না। এইভাবে অ্যাবসেন্ট করলে তো তাহলে হলো। So anterior superior iliac spine. This is anterior superior iliac spine. It is anterior projection from the iliac crest, and it serves as an attachment point for the sartorius muscle and the inguinal ligament. Here, sartorius muscle and lateral attachment of the inguinal ligament. Next is anterior inferior iliac spine. Here is the anterior inferior iliac spine. It is a projection below the anterior superior iliac spine, and it is gives an attachment point for the rectus femoris. Okay, straight head of the rectus femoris. Next we are going to some presenting parts of pubis. This red colored portion is the pubis. It has a symphysis pubis or pubic symphysis. It is the secondary cartilaginous joint. Type of joint is, must remember, very frequently asked. Pubic symphysis type of joint is secondary cartilaginous joint between the two pubic bones. And body of the pubis is flattened. See, this part is the body of pubis. It is flattened anteroposteriorly, and the medial end of pubis that lies adjacent to the symphysis pubis. Its medial border of the two bones forming the symphysis pubis. Inferior ramus or pubic ramus. Here is the inferior pubic ramus. It is thin, flat downward extension, and that runs diagonally from the medial part of the pubis to the ischial ramus, and it gives attachment to the adductor group of muscles. Okay, adductor brevis, adductor magnus, gracilis attached to this ramus. Next is superior pubic ramus. This is superior pubic ramus. It is a band of bone and that runs along the superior aspect of the pubis. Surface of this ramus is an attachment site for the pectineus muscle. Okay, pectineal surface gives attachment to this muscle, and inferior surface forms the obturator canal, which gives passage to the obturator nerve and vessels. Next is pubic crest. This part is pubic crest. It is a short superomedial ridge and that extends horizontally from symphysis pubis to the pubic tubercle. Symphysis pubis to pubic tubercle. This small part is the pubic crest, and it is an attachment point for the abdominal muscles. Next is pubic tubercle. This projecting part is pubic tubercle. It is a projection from the lateral end of the pubic crest and serves as an attachment point for the inguinal ligament. Okay. Next, we are going to different presenting parts of the ischium. Ischium has a ramus. Ramus of the ischium is thin. This part is the ramus of the ischium. Together with the inferior ramus of pubis, it is forming the ischiopubic ramus. So, ramus of ischium is a thin, flat, anterior extension of the ischium, and that joins with the inferior ramus of pubis and the adductor magnus muscle attached along its surface. Okay. Next, there is other important landmarks. Obturator foramen. The large foramen you can see, this is obturator foramen. It is a large opening enclosed by the pubic and ischial rami. Mainly this lying in between the ischium and the pubis. Anteriorly lies the pubis, posteriorly ischium. Next is acetabulum. This large depression lying laterally. This is acetabular cavity. It is a large rounded depression on the external or lateral surface of the os coxa. Coxa means hip bone, okay, and it is formed by portions of the ilium, ischium and pubis. All the bones are included. 2/3 by the ilium, 2/3 by the ischium, 1/3 by the pubis. Okay, and it accepts the head of the femur to form the hip joint. Next, we are discuss the different views. In lateral view, you can see the iliac crest. This is iliac crest. We have already discussed its attachments. Iliac tubercle. Iliac tubercle, see this projecting part here over the iliac crest. This is almost 5 cm behind this anterior superior iliac spine and lying along the outer lip of the iliac crest. This projecting part is known as iliac tubercle. This is also asked in your viva table. Tubercle of the iliac crest, it is a prominent bulge on the outer lip of the iliac crest near its midpoint, and this area is an attachment site for the iliotibial tract or iliotibial band. Okay. Next is anterior superior iliac spine. This is anterior superior iliac spine. Projection from the anterior portion of the iliac crest, and the sartorius muscle and inguinal ligament is attached to this elevation. Next is anterior inferior iliac spine. Here anterior inferior iliac spine. It is a projection below the anterior superior iliac spine, serves an attachment point for the rectus femoris muscle. Okay, straight head. Next is posterior superior iliac spine. This is posterior superior iliac spine. Projection from the posterior part of the iliac crest, and it is an attachment point for the posterior sacroiliac ligament and the multifidus muscle. And posterior inferior iliac spine, it is a curvature found inferior to the posterior superior iliac spine, and these two spines are separated by a small notch. This is a small notch, and a ligament that binds the ilium to the sacrum attaches here. Okay, sacroiliac ligament is attached here, and posterior inferior iliac spine. Next, we are going to the different gluteal. On the lateral view, you can see the gluteal surface of the ilium. Okay, this is gluteal surface. three gluteal lines are there. Okay, this is posterior gluteal line, this is anterior gluteal line, here is the inferior gluteal line. So posterior gluteal and all the lines are converging at this notch. This notch is greater sciatic notch. And this projecting spine is known as the ischial spine, and below the ischial spine this notch is the lesser sciatic notch. Okay, and these two notches are converted into foramen by the sacroiliac and sacrospinous ligament. Okay, so we'll discuss the lines and attachments of different muscles. So posterior gluteal line is a short ridge on the external surface of the ilium, runs vertically between the iliac crest and the greater sciatic notch. This is posterior gluteal line, just anterior to the posterior spines, and this line is the anterior attachment point for gluteus maximus. Posterior to this posterior gluteal line, this area gives attachment to the gluteus maximus, and posterior attachment point for gluteus medius. The area between the anterior and posterior gluteal line, here is attachment of gluteus medius, and in between the anterior and inferior gluteal line, here is the gluteus minimus. Okay, so an anterior gluteal line is a long posteriorly curved ridge, this one, and that spans the mid portion of the external ilium, and the ridge serves as the anterior attachment for medius and superior attachment for minimus. Okay, inferior gluteal line, this one, it is a slight ridge that runs diagonally across the external surface of ilium from anterior inferior iliac spine to the greater sciatic notch, and it is the inferior attachment point for the gluteus medius muscle and superior attachment point for gluteus minimus. Okay, next, in lateral view, what structures of pubis you can see. Body of the pubis, this part is body, it is the flattened part. Medial end of pubis lies adjacent to the symphysis. Inferior pubic ramus, superior pubic ramus, and the pubic tubercle. All these can be seen. Okay, this pubic tubercle gives attachment to the inguinal ligament. Okay, this you must remember, attachment point of inguinal ligament. Superior ramus gives attachment to the pectineus muscle. Okay. Next, ischium. What are the structures visible on ischium? First is ischial tuberosity. This large thickened part, this part is known as ischial tuberosity. It is rough and curved eminence located at the junction of posterior and inferior border of the ischium, and it serves as an attachment point for the hamstring group of muscles. Okay, sacrotuberous ligament and the hamstring muscles, quadratus femoris muscle, and the inferior gemellus muscle. Inferior ramus of ischium, this one is inferior ramus of ischium. It is anterior extension from the ischial tuberosity, joins the inferior ramus of pubis, and the adductor magnus and obturator external muscles attached to this portion of ischium. Next is ischial spine. This part is ischial spine. It is a sharp projection from the posterior margin of the ischium, and it is an attachment point for the sacrospinous ligament. Next is lesser sciatic notch. Below the spine is it is a small indentation located inferior to the spine. Here is the lesser sciatic notch. Through it passes the pin structure, pudendal nerve, internal pudendal vessels, and nerve to obturator internus. Okay. So greater sciatic notch. This is the greater sciatic notch. Large indentation located below the posterior inferior iliac spine and above this ischial spine. Okay, and obturator foramen, we have already discussed, large anterior opening enclosed by the pubis and ischial ramen. Acetabulum, here is the acetabulum. And medial view also, you can see the iliac. This is medial view. You can see the iliac crest, anterior superior iliac spine, anterior inferior iliac spine. Also the posterior superior iliac spine, posterior inferior iliac spine, the iliac fossa. Iliac tuberosity. Okay, iliac tuberosity in an iliac tubercle is different, not same. Okay, iliac tubercle is lying on the outer lip, 5 centimeter posterior to the anterior superior iliac spine. But here lies the iliac tuberosity. Iliac tuberosity is roughened area located inferior to the iliac crest and posterior to the iliac fossa here. And the posterior sacroiliac ligaments and the sacrospinalis and multifidus muscles attach here. Okay. Next, there is a articular surface here, and this surface is known as sacropelvic surface. So, ilium has three surfaces: iliac fossa, gluteal surface, and sacropelvic surface. This iliac tuberosity articular area and this area included in the sacropelvic surface. So, articular surface is L-shaped and ear-shaped roughened surface situated inferior to the tuberosity here. And this area articulates with articular surface of sacrum to form the sacroiliac joint. Okay, this is synovial joint. Next is arcuate line. This line you can see extending from this articular surface up to the iliopubic eminence. This line is arcuate line forming boundary of the pelvic inlet. So, arcuate line is a curved ridge that forms the inferior boundary of the iliac fossa, also delineates the boundary between the body and the wing, that is larger expanded portion of the ilium. Next is you also can see the pubic symphysis pubis, secondary cartilaginous joint between the two pubic bones. Another things you can see is the bony pubis, bony part of the body of the pubis, and the inferior pubic ramus. Okay. Inferior ramus gives attachment to the adductor muscles. Superior ramus of the pubis, the pectineal line. Okay, from the iliopubic eminence up to the pubic tubercle, this line is known as the pectineal line. Okay, and these together, this pectineal line and arcuate line, these together is forming the linea terminalis. Okay, this term is also asked in your viva, linea terminalis. Okay, so this pectineal line you can see here, it is the sharp ridge runs along the superior margin of superior pubic ramus, and this area, which is also called pecten pubis, it is the attachment point for the pectineus muscle. Next is pubic crest. Here is the pubic crest. Short superior-medial ridge extends horizontally from the symphysis pubis to the pubic tubercle, and attachment point for the abdominal muscles, rectus abdominis muscle. Okay. Pubic tubercle is projection from the lateral end of pubic crest here, and that serves an attachment point for the inguinal ligament. Next, for ischium, you will see the ischial tuberosity, inferior ramus of the ischium, ischial spine. Ischial spine is a sharp projection from the posterior margin of ischium, attachment point for sacrospinous ligament. Okay, and the lesser sciatic notch. So, other bony landmarks you will see is the greater sciatic notch, the obturator foramen. So, what is the anatomical position? How will you determine the site and how will you hold it in anatomical position? So, the site of the bone is determined by holding it in such a way that acetabulum is directed laterally. This is acetabulum, it is directed laterally. The obturator foramen lies below the acetabulum. This is obturator foramen lies below the acetabulum. And the flat expanded ilium is directed upward. This is ilium, flat expanded ilium is directed upward. Thin pubis is directed anteromedially. This part is pubis directed anteromedially. Thick ischium is directed posterior-inferiorly. Okay, and the pubic tubercle and the anterior superior iliac spine, they are lying in the same coronal plane. And the ischial tuberosity occupies the lowermost portion. So this is hip bone of left side. Okay. So your main point you remember, acetabulum cavity is facing laterally, obturator foramen below the acetabulum, iliac crest is above, and this pubic tubercle Pubic symphysis and the anterior superior iliac spine, they will lie in the same coronal plane. Okay, understood? So this is the anatomical position of left hip bone. And this is the anatomical position of the right hip bone. Okay. And also you have to know how to hold the pelvis in anatomical position. You hold it like this. Okay. This is the anatomical position of pelvis. This mainly this pubic tubercle and anterior superior iliac spine will lie in the same coronal plane. Okay. And sacrum is placed like this as if it is stooping forward. Okay. This concave surface is directed downward. Understood? So this will be the anatomical position of the pelvis, very frequently given in your viva table, pelvis. Okay. So you will be able to hold it in anatomical position. Okay. So see here. This is schematic diagram of the hip bone, lateral view. This is view from outer aspect, inner aspect. Here is the gluteal line, posterior, anterior, inferior. Posterior superior iliac spine, posterior inferior iliac spine, anterior superior iliac spine, anterior inferior iliac spine. Here is the tubercle of the iliac crest. Okay. This is acetabular cavity. And this is pubis, ischium, ischial tuberosity, ischial spine, greater sciatic notch, lesser sciatic notch. And here you can see the iliac crest, anterior, superior, anterior, inferior iliac spine, iliopubic eminence, pectineal line, arcuate line. Here is the iliac tuberosity. This is the articular surface, pelvic surface of the ilium. And this is the ischium, ischial tuberosity, ischial spine, body of the pubis, symphysis pubis, superior and inferior ramus of the pubis. Okay. And these are the muscle attachment you can see. This is attachment of internal oblique, external oblique, tensor fascia lata, latissimus dorsi along the anterior 2/3 of the iliac crest, posterior 1/3, this gluteus maximus. In between the anterior and posterior gluteal line, gluteus medius. In between the anterior and inferior gluteal line, gluteus minimus. And below the inferior gluteal line, along the margin of this acetabular cavity, here is the oblique head of the rectus femoris. Okay. And here is the straight head arises from the anterior inferior iliac spine. Okay. Here is insert ligament is attached also, iliofemoral ligament, and near the anterior superior iliac spine attachment of sartorius muscle and the inguinal ligament. Other end is attached to the pubic tubercle. Along the pectineal line, pectineus, here is the adductor longus over the body of the pubis, and these are the other adductor muscles, adductor longus, adductor brevis, gracilis, and the adductor magnus. Adductor magnus is a composite muscle. It has adductor component, and some is hamstring component. Okay. So this is adductor magnus. Here are the hamstring muscles, semimembranosus, semitendinosus, and this is quadratus femoris. Okay. And this area is along semitendinosus along with the long head of biceps femoris. And these are the two gamellae at the upper and lower margin of the lesser sciatic notch, superior and inferior gamellae. Okay, and through this lesser sciatic notch passes the tendon of obturator internus, together forming the tricipital tendon. And here along the margin of obturator foramen, obturator externus. This is outer surface, obturator externus. Along the inner surface, obturator internus, and it extends upward like this, obturator internus. Okay, and here at this part, attachment of ventral sacroiliac ligament. Here dorsal sacroiliac ligament. Here is the interosseous sacroiliac ligament. These three are the sacroiliac ligament of sacroiliac joint. Here is attachment of iliolumbar ligament, and over the iliac fossa, iliacus muscle. And along the inner margin, you can see the transversus abdominis, here sartorius, quadratus lumborum, and dorsal 1/3 erector spinae. Okay. Okay. And here is psoas minor near the iliopubic eminence. Okay. And this is sometimes absent also. And here levator ani on the anteriorly, here it is originating, and posteriorly on the inner aspect of the ischial spine. Levator ani and coccygeus is attached here. Okay. And they are forming the pelvic diaphragm. Okay, so these are the muscle attachments over the hip bone. This is iliac crest, we have already discussed. And you can see here is the attachment of the piriformis muscle. Okay, piriformis, some part originating from the sacrum, some part from the ilium, and it is coming out through the greater sciatic foramen. And above the piriformis, you have read during the gluteal region. Which structures are passing? Superior gluteal vessel, superior gluteal nerve. Below the piriformis, these nerves. Okay, pin structure, the inferior gluteal vessels, and the other nerve, sciatic nerve and posterior femoral cutaneous nerve, all these are coming out. Nerve to obturator internus, nerve to quadratus femoris, all these are coming out below the piriformis. And you can see the conversion into foramen. This is attachment of sacrotuberous ligament. One end is attached near the sacroiliac joint, other end to the ischial tuberosity. And this is sacrospinous ligament. Attachment, other end is attached to the sacrum and other end is attached to the ischial spine. It is converted, this is greater sciatic foramen, lesser sciatic foramen. And this pin structure are lying over the, this pin structure are lying over the ischial spine. They are coming out through the greater sciatic foramen, then again entering into the pelvic cavity through the lesser sciatic foramen. Okay. And this muscle, the ischial tuberosity is divided by a ridge into upper quadrangular area, lower triangular area. Okay, upper quadrangular area is again divided by oblique ridge into upper and medial part, gives origin to the semimembranosus, and lower and lateral part semitendinosus and long head of the biceps femoris. And the lower triangular area divided by a vertical ridge into a medial part and lateral part. Lateral part contains fibrofatty tissue. It comes in contact with the floor while sitting over the buttock. Okay, and this medial part gives origin to the adductor magnus, hamstring part of the adductor magnus, and adductor component of adductor magnus from the ramus of the ischium. Okay, and this we have discussed. Okay, and here is the obturator canal. You can see at the upper margin of the obturator foramen. Through it passes the obturator vessels and the obturator nerve. Okay, and on the inner surface of the ischiopubic ramus, it is divided into three areas by two ridges. Okay, so upper area gives attachment to the obturator internus. The upper ridge gives attachment to the superior layer of the urogenital diaphragm, and the lower ridge gives attachment to the inferior layer of the urogenital diaphragm, and they form the closed space. That closed space is known as the deep perineal pouch. Okay, and in between these two ridges gives attachment to the sphincter urethrae and transversus perineae profundus. And below the inferior ridge, here is attachment of the istiocavernosus and the transversus perineae superficialis. These muscles you will get during the perineum. Okay, and along the lower margin of the ramus, there is attachment of fossa collis. Okay. So other we have discussed. Here is the psoas minor, occasional presence. Here is the piriformis. And see the insertion of these two obturator internus coming out through this lesser sciatic foramen and going inserted over the tip of the greater trochanter. And this is obturator externus going to insert into the trochanteric fossa. Okay, and here is the attachment of the ischial tuberosity upper quadrangular area, lower triangular area. 2 divided by oblique ridge into 2 parts. Upper and lateral semimembranosus, lower and medial, conjoint origin of semitendinosus, long head of biceps femoris, and the lower area divided by a ridge into lateral part, medial part. Lateral part contain fibrofatty tissue and act as a cushion, and at medial part adductor magnus, hamstring part. Okay. So attachment of ischial tuberosity you must read. Okay. This is very frequently asked in your viva. Attachment of iliac crest, iliac fossa, anterior superior iliac spine, ischial tuberosity. These are very frequently asked in your viva. Very commonly asked. Okay. And you can see here the 2/5 upper 2/5 portion is formed by the this ilium. Posterior-inferior 2/5 by the ischium and antero-inferior 1/5 by the pubis. These three bones together is forming the acetabular cavity. In the middle of the cavity, there is acetabular fossa which contains the fibrofatty tissue, and surrounding it there is a horseshoe-shaped articular surface. Okay, and this articulates with head of femur forming the hip joint. Okay, and along the margin of the acetabulum, attachment of acetabulum labrum, which is a fibrocartilage, and here is the ischial tuberosity, articular surface. All these we have discussed already. This prominence is known as iliopubic eminence. The lines have been shown. Lines are dividing this part into 3 parts, upper, middle, lower. We have discussed the muscle attachments. Okay, Iliac crest. Okay. So next we are going to the difference between the male and female hip bones. Greater sciatic notch is wider, that is about 75 degree in female, and it is narrower in male, less than 50 degree in male. Ischial spine is not inverted in female, and male it is inverted. Okay, and ischiopubic ramus is thin and not everted. Male it is thick and everted due to pull of the muscles. And obturator foramen is triangular in female, it is oval in male, oval, and it will be larger in case of male. Acetabular diameter is less than 5 cm. Here acetabular diameter is more than 5 cm. Distance between the pubic tubercle and anterior acetabular margin, it is less than transverse diameter of the acetabulum. And in male, it is equal to the transverse diameter of the acetabulum. Preauricular sulcus. This is also an important thing you will be asked. Here, there is the preauricular sulcus just in front of the articular surface. Okay, this is prominent in female because ventral sacroiliac ligament is attached here and it is traced during the childbirth. That's why this become prominent in female. So preauricular sulcus is more conspicuous and it is less conspicuous in male. And to facilitate this childbirth, these features are present. Obturator foramen is triangular and small. This ischial spine is not inverted. Okay, these features helps in childbirth. And this iliac fossa is shallower in female and iliac fossa is deeper in male. Okay, and for pelvis, you remember this subpubic angle. This is a acute angle in case of male and the angle is more in case of female. In case of female, it forms almost 80 to 90 degree angle and male it is 40 to 50 degree. Okay. So next we are going to the ossification of hip joint. It has 3 primary center and some secondary centers. Mostly 5 secondary centers. So 8 secondary centers. So 3 primary centers appears before birth. One for ilium, one for ischium, one for pubis. For ilium appears at 2nd month of intrauterine life. For ischium, 3rd month of intrauterine life, and for pubis, 4th month of intrauterine life. And they fuse together at 18th years of age. Okay. And secondary centers appear 2 for the iliac crest, 2 for the biciped acetabular cartilage, and 1 for the ischial tuberosity. And they appears at puberty, and they fuse with the hip bone, other parts of the hip bone, at about 20 to 25 years of age, except the acetabular cartilage, biciped acetabular cartilage, which ossifies at the age of 17 years. Okay, and some other centers are present in other areas. Okay, these three you remember. Okay, that's all. So hip bone, you will be able to hold it in anatomical position, and you will describe the presenting parts and read the muscle attachments. Okay, understood? Patella is done. Okay, so I am only discussing the anatomical position. So this is patella, the rough area. You can see one surface is rough and convex, another surface is smooth. Rough surface you place anteriorly, smooth surface posteriorly. And below this smooth surface there is a rough area. You place it downward, that is apex of the patella. Okay. Opposite to the apex is the base. This is medial and lateral margins. Two margins are there, anterior surface and posterior surface. And this articular surface is again divided by a particular ridge into a larger lateral part and smaller medial part. Okay, so if you place the patella on a flat surface with apex away from you, patella will tilt to its side. Okay, so it is a patella of left side. Okay, and you hold it with its apex with the same hand to which side it belongs. So this is patella of left side. Okay, and muscle attachment you remember at the apex ligamentum patelli, at the base the four muscles of the quadriceps femoris, anteriorly rectus femoris, then vastus medialis, vastus lateralis. These two are also extending along the margins, okay, medial and lateral margins, and deepermost is the vastus intermedius. Understood? And you remember the which area articulating with which area of the femur in different position of the knee joint. Okay. Okay, so how will you hold it in anatomical position? Apex faces downward, its base faces upward, articular surface faces posteriorly, large lateral part of articular surface determines the side. And keep the articular surface of patella on a tabletop in such a way that its base is directed towards you and apex away from you. And now observe the tilt of the patella, and the patella as a rule always tilts towards the side to which it belongs. Okay. Muscle attachment, ligamentum patelli. Here are the four muscles: rectus femoris, vastus medialis, vastus lateralis, vastus intermedius. And you can see vastus medialis extending more downward than the vastus lateralis. And these are muscular ridges. And patella is a sesamoid bone, okay, formed in the tendon of quadriceps femoris. It has no blood supply, okay. And these areas you remember: upper area in ordinary flexion, middle area during semi-flexion, lower area during ordinary knee extension. Okay, and this area, this small medialmost area, comes in contact with femur only in full flexion of the knee joint. Okay. Okay, that's all. And ossification, it appears at 3 to 6 years, fuse quickly to form a single center, and ossification is completed at the puberty. Okay. The clinical aspect we have already described: bipartite, tripartite patella, and fracture, dislocation of patella, fracture of patella, all these are important. Okay, okay, that's all. Any queries from this topic? No queries? Okay, so you practice holding the hip bone in anatomical position and read it different parts. Okay, it is important both for inferior extremity, also for the abdomen and pelvis. Okay, that's why muscle attachments are very important for